In this video we will show you how to treat bronchitis. Acute bronchitis is an infection of the major bronchial tubes that lead to the lungs. It usually follows the cold or flu virus, when your immune system is weakened and your lungs are already irritated. To treat bronchitis, you may need to use over-the-counter pain medication or medication meant to soothe your throat, while also getting plenty of rest, drinking warm fluids, easing chest discomfort with a hot compress, and breathing in steam to soothe your bronchial passageways. Part 1. Get immediate relief. 1. Drink warm fluids. Keeping yourself hydrated is important while your body is fighting infection, and drinking fluids with a warm temperature can help soothe your sore throat and keep the phlegm, the substance you cough up when you have bronchitis, loose and easier to expel. Try these warm fluids to help you get through bronchitis. Warm water with lemon and honey. Heat up a mug of warm water and add lemon juice and honey to taste. The honey coats and soothes your throat, and the lemon provides vitamin C and other nutrients. Chamomile, peppermint, or another herbal tea. Herbal teas, especially those made to help treat sore throats, serve the dual purpose of hydrating your body and treating your symptoms. 2. Use a hot compress on your chest. Bronchitis can make your chest feel heavy and painful, especially when you're coughing frequently. Applying heat can help ease the pressure. Try one of the following methods of heating your chest. Fill a hot water bottle with water and lay it on your chest. Use a heating pad on your chest. Place it over your clothing so it doesn't overheat your skin. Cover yourself with an electric blanket. Take a warm bath or shower. 3. Breathe warm, moist air. When your lungs are irritated, hydrating them with warm, moist air helps soothe your bronchial passageways. If you allow your throat to dry out, your lungs can become more irritated, prolonging the infection. Try the following methods for breathing humid air. Use a humidifier. Humidifiers are machines that add moisture to the air in a room. They're available for purchase at drugstores. Boil a pot of water on the stove. The steam produced from the boiling water can increase the room's humidity. 4. Avoid smoke and other lung irritants. Inhaling smoke can bring on painful coughing fits when you have bronchitis. It can also delay your lungs' healing process. Avoid smoking or inhaling secondhand smoke. Stay away from these lung irritants. 2. Areas with excessive pollution, such as streets with high traffic volume. Areas with a strong chemical smell, like the inside of factories, hair salons, and gas stations. 5. Let yourself cough. The act of coughing when you have bronchitis helps expel the infection from your lungs. Coughing up phlegm is a normal symptom. If you take an over-the-counter cough suppressant, you prevent your lungs from healing. If your coughing is extremely painful or constant, you should see a doctor. Make sure you aren't experiencing symptoms for something other than bronchitis. Oftentimes pneumonia and bronchitis have similar symptoms. It is important to see a doctor in order to differentiate the two. Never take an over-the-counter suppressant without first consulting a doctor. Part 2. Treat with medicines at home. 1. Take an over-the-counter pain medicine. Non-steroidal anti-inflammatory drugs, NSAIDs, containing aspirin or ibuprofen can help relieve the pain caused by the infection in your chest. Be sure not to take more than the recommended dosage. 2. Try medicines that soothe your throat. You should avoid taking cough suppressants if possible, but there's nothing wrong with taking medicine meant to treat your sore throat. Look for an over-the-counter medicine containing benzocaine, with help soothe irritated throat tissue. It comes in syrup and cough drop form. Pour a half cup of honey and a few drops of peppermint extract or eucalyptus oil into a small pot. Place the pot over medium-high heat. Stir it constantly as it comes to a boil. Use a spoon to scoop drops of honey onto a baking sheet lined with oiled parchment or wax paper. Wait for the drops to harden, then suck on them to soothe your throat. Part 3. Seek treatment from a doctor. 1. Know when it is time to seek professional care. Your body usually heals itself from bronchitis after a week or so. However, there are cases in which the lungs are unable to expel the infection. Make a doctor's appointment if you experience the following. You cough so much you can't sleep at night. You cough up blood. It feels weak to cough. You keep coughing, yet hardly no mucus comes up. You notice an increase in the amount or thickness of the phlegm you cough up. 2. Take a cough suppressant if you can't sleep. If your cough keeps you from sleeping at night or causes extreme pain, your doctor may prescribe or recommend an over-the-counter cough suppressant. Coughing constantly over a long period of time can be hard on your body, and your doctor may decide that a cough suppressant would be beneficial to your health. 3. Determine whether you have a bacterial infection. Bronchitis is usually caused by a virus, but since it irritates the lungs, it makes the body more susceptible to getting a bacterial infection at the same time. If your doctor determines you have a bacterial infection, you may be prescribed an antibiotic. Smoking increases the chances of getting a bacterial infection in your lungs. 4. Determine whether you have chronic bronchitis. Chronic bronchitis is a lung infection that persists over the course of several years, with symptoms that ebb and flow over time. It is usually caused by smoking or the continual inhalation of another lung irritant. Thanks for watching. Subscribe our YouTube channel for more videos.